Hey, how you doing? Welcome to another episode on the Mulligan PT channel. I am Brian, the PT guy, and today we have the wonderful topic we're going to discuss of shoulders. Who doesn't like a good shoulder joint? So we're going to talk a little bit about the anatomy, a little bit about injuries, a little bit about how we can correct things and how we can fix things, and some of the treatment options that we can look at if you're suffering from a shoulder issue. So we're going to dive right in. I'm going to be real plain and simple. We won't use any models or anything else to confuse you. I love anatomy. I love the anatomy of the shoulder, but I'll leave it up to you guys to go out and Google some pictures and some videos and see what's really happening in there. We'll keep it real simple. So if you're not aware, in 2005 there was a study that was done that 7 million people had gone to the doctor to see about a shoulder problem. And out of those, 4 million had rotator cuff issues. So there's lots of common shoulder problems that can occur. The shoulder joint is a very complex joint, and there's lots of things happening there. There's lots of moving parts, and there's lots of potential for injury or irritation. So some of the common injuries that can occur in the shoulder joint can be anything from a tendonitis to a bursitis to arthritis or any other itis you could think of. You can have fractures of the humerus, which is the bone in the upper part of the arm. You can have fractures to the clavicle. You can have separation of joints up in the shoulder. You can have muscle tears, tendon tears, ligament tears. Any of these wonderful things can happen. So what we want to do is break down a little bit about what's happening in there. So if you're not aware, the shoulder is a ball and socket joint. So that just means exactly like it sounds. There's a ball on the end of the humerus, which is up here. There's a socket on the scapula, which is the upper part of your shoulder bone. They lock in together and then all the movement occurs. So the shoulder joint is different than the hip joint, which is also a ball and socket, because the hip joint is a very deep socket. So that is holding the ball of the femur in a lot more securely. So the shoulder, therefore, is a little bit more unstable, a lot more unstable, actually. And what's really holding that together is your ligaments, your tendons, your muscles, and other connective tissue in there. So when it has to hold all that together and those things go wrong, now we lose some stability and we gain more problems with the shoulder. So any of you who have tuned in before, you've watched me talk about posture. So posture is a big impact as well on the shoulder joint, and I love to talk to patients about posture all the time. That's one of the things I will definitely talk to anybody that comes in my office that has a shoulder problem. We talk about posture. We work on posture. You kind of can't get around it. So going into the shoulder joint, some of the things that are going to occur there is going to be tendonitis, which is generally a repetitive stress injury. And I tell my patients all the time, repetitive stress injuries, especially the shoulder, you don't have to be an overhead tennis player or throwing a ball all the time. It doesn't necessarily happen that way. It can, but a lot of patients that I see, especially the senior citizens that are coming in, is just lots of wear and tear on our bodies, and unfortunately that just happens. We can't avoid it. It's wear and tear that occurs that their repetitive stress is really just their activities of daily living. So putting clothing on, doing their hair, washing their hair, putting dishes in the cabinets overhead, all of these things become repetitive day in and day out. So therefore, sometimes that leads to what we would consider a repetitive stress injury, which is really a tendonitis. The tendonitis is usually going to occur in one of the 4 rotator cuff muscles. There's 4 of them. And yes, I said cuff. It's rotator cuff, not cup or anything else people call it. It is the rotator cuff. And the rotator cuff is made up of 4 muscles. And the purpose of those 4 muscles is to support and stabilize and help the shoulder as it moves. That's a real layman's terms of how it works. So out of these 4 muscles, certain ones will become more irritated in general than others. You can have issues with any one of them. You can have issues with all 4 of them or anything in between. But generally there is one muscle that becomes the biggest issue. And when that tendon, which is attaching to the bone, becomes irritated and inflamed, it now causes problems in the shoulder. So if any of you have ever had a cut, and I'm sure most of you have, what happens with that cut? Our body's response is there's an inflammatory response. We get increased blood flow, we get increased swelling, we get increased heat, we get increased irritation to that area. So it's the same when you have an area that you can't physically see it. There's inflammation going on underneath inside that joint area. You can't really see it. It doesn't really show up as swelling like it would on an elbow or a knee or somewhere else that's real superficial. So it gets inflamed in there. And what's getting inflamed is the movement of the joint and the tendons and the ligaments and everything that's inflamed in there. That's what's going to inflame it even more. So as you keep moving it and using it and lifting it and carrying things, it's getting more and more inflamed. So with the shoulders, the tough part is we can't just sit and really rest them like we can an ankle or a knee or something that we can just sit and put our leg up. We're always using our arms and our hands, so it's harder to get that to relax. Also, the way your shoulder is designed, it kind of hangs with gravity, and because there's a lot of other structures that support it, the hanging motion is also kind of dragging it down to cause more irritation, more so than other joints. So a tendonitis is probably the most mild issue that would go on, a bursitis, tendonitis. A lot of times these are interchangeable, but at the same time, the bursitis, which is just a fluid-filled sac which provides some shock absorption across the tendons, is located on the outside of the shoulder where some of the tendons are. So if you're going to have a tendonitis or a bursitis, chances are you're going to have both because there's inflammation in there. So as that gets irritated and inflamed, it will do one of three main things. You'll create pain, you'll lose motion, and therefore you'll also lose strength. So most people that come in with a shoulder problem, those are the three main things they're dealing with. And the pain can be any kind of variety, and a lot of times it's a combination of movements of the shoulder. It's not just one direction because it goes in so many different directions. The main directions of the shoulder are going to be forward, out to the side, back behind your head, back behind your back, behind you, and everywhere in between. So any one of those motions, because there's so much motion in the shoulder, can irritate. So a lot of patients that come in that I see will have problems with a certain motion, like out here or back here, but when they do this overhead, they're fine. Now, we don't usually function too much directly in front of us. We usually function a little bit off of our body center, out here somewhere when we're getting things out of a cabinet or reaching for high things. So the combination of movements is what makes it difficult, because some people, they just don't have too much issue until they go in that one motion and then they start to feel it. So when that happens, most people that I see that come in, just like all of you out there watching, probably thinking, oh, I have a little twinge in my arm, it hurts a little bit, it'll go away. And then a week goes by, it's still a little twingy in there, it'll go away. And then you wait and you wait and you wait. What happens with the shoulder, though, is it can become frozen, and that is a separate situation, so don't want to confuse those that are watching and critiquing all this. It can become frozen in the way that you're going to lose more motion because you stop using it, and that's generally what happens with the shoulder. If my arm hurts to go up this high, guess what? I'm not going to go that high. I'm going to come down about here. Now here's my new normal. I can go from here to here because that's comfortable. If I go any higher, it hurts, so I don't want to go there. So all of a sudden now your new range of motion, instead of being all the way up here where it's supposed to be, is now here. And if that process keeps going on, you're going to get less and less motion in every single direction that you go in. So the same applies for behind your head. Most people will notice that if they go to wash their hair, itch their head, do anything like that overhead, put clothing on overhead, if their arm used to go all the way back here, now it only goes to here, they're going to start to notice that. So once the function starts changing, that's generally when most people start noticing this. Unless they jump on it right away and say, hey, I had shoulder pain a day ago, I want to come in and get this treated. So the things that can develop from that, like I said, is tendonitis or bursitis. Further down the line would be a rotator cuff tear, partial tear. Some of the fibers tear, sometimes the whole thing tears. And again, it's made up of 4 muscles, so usually it's going to be one muscle first that tears. Sometimes you get multiple tears. That's the most common things that we see here, is more of the tendonitis, rotator cuff issue situation. There's also a piece of connective tissue inside the joint itself called the labrum. And that's a piece of cartilage that sits inside the joint, and sometimes that will get torn from trauma, from sports, from other things. That can become irritating as well. Arthritis, just like any other joint, it's going to be a change in the structure of the joint because of abnormal forces, and it's going to cause pain because now you're getting less shock absorption, you're getting more bone on bone, and it hurts every time it rubs when it moves. You can have AC joint problems, which is where the clavicle attaches to the shoulder joint, scapula. And what's going to happen there is, again, same thing, you can get arthritis at those joints, you can get a separation at those joints, so you're going to get pain there. Now, how do all these things happen? So there's a variation of what can happen when it comes to shoulder problems. The one, like we talked about, is repetitive stress. Doesn't take much. So some people are playing sports, overhead sports, and the repetition constantly is causing the problem. So other times it can be an injury that occurs, a fall on an outstretched arm. It can be a fall at home. It can be a hit in sports. Somebody gets you from behind, somebody gets you off the side. You can damage things that way as well. So Injuries do occur to the shoulder based off of impact as well. And a lot of times what happens is people that fall on it, they may not even know that they did anything to it. Maybe they're a little sore, but otherwise they don't feel too much different. Once they start healing up from the fall, they think, yeah, everything's okay. And then as the weeks go on, all of a sudden they realize like, oh, my arm hurts a little bit as they go up this way or out this way, or now it doesn't quite go as high. So the injury actually caused the problem. And if they don't address it, then other things start falling into place. So it could be initial injury that damaged it, that caused just the tendonitis. So now it's just inflamed. And then over time, if they don't get it treated, the inflammation gets worse and maybe it starts to tear or fray a little bit because of that. Or the initial impact is what caused a tear or a partial tear. And if there's a second impact, that might have been the last straw and now tore completely. So those things can happen. And the same thing can happen with injuries when it comes to the AC joint. You can get a fracture or separation at the AC joint. The labrum can also tear from impact. So there's definitely different situations that can occur that will cause an injury to the shoulder joint. So what do we do about all this? Well, arthritis is another one that really is just a time thing. The arthritis develops over time. And sometimes, again, if there was a fall or some kind of impact to the shoulder, it's just going to create more irritation to an already irritated joint. So now the shoulder feels worse sometimes as a result of that. So when that starts happening, what I would recommend is when you start noticing some shoulder issues, sometimes we'll just call them a little twinge or something else that's a little irritated in there. I would definitely have somebody look at it because you don't want it to lead to something that would last longer or take longer to get over or start getting worse as you go. Now, we as physical therapists, we treat this, we evaluate this all the time. I see a lot of shoulder patients here. And when I treat them, what we're doing is looking at, again, evaluating what causes their pain. We're looking at causes for the pain, what movements are causing the pain. We're looking at their strength, their mobility, seeing how many limitations they have overall. And a lot of times, again, when we go to look at this and evaluate this, a lot of times what we're seeing is their posturing. So if I'm rounded from the shoulders here, every time I move my arm, one's going to happen is I'm not going to get it as high because as the upper thoracic spine or upper back starts to round, it limits how much motion we actually have at the shoulder. So just by correcting that posture can allow more motion at the shoulder mechanically. Now, if my shoulders are rounded a little bit, they're also pinching the tendons that are getting impinged, which we talked about earlier, in the shoulder. And then every time I move, it just pinch, 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 pinch. So just by getting the shoulders back and opening up that space across the front of the chest and the shoulders is going to allow more natural movement and less impinging type movements. So that's why posture is a big thing. And I'm always a big, big fan of posture. So we work on posture a lot. Now, posture for most people thinks you're just sitting up straight, which is definitely part of it. But what happens is the muscles on the upper back across your scapulas and the upper back of your thoracic spine, lower cervical spine region, all of those muscles overlap into the shoulder joint area. So those are the muscles that you really have to work on in order to get your posture to stay in place. So I'll send you to the other video to check out the posture, more on that in detail. So if you have a shoulder problem outside of being evaluated for physical therapy, what do we do? So for physical therapy, my approach to it is definitely not a no pain, no gain kind of thing. I believe that if we're going to cause pain and push through it with the shoulder, you're just creating more problems. It already hurts to move it, right? So if I'm going to take a 2-pound weight in my arm, when my arm already hurts when I move it without anything, well, that's just going to add more stress to the area and cause more pain, which is going to in turn cause more inflammation. So for me personally, and other therapists would agree, some would disagree, and that's fine. I don't believe that we should be pushing it through a lot of pain at all. My main approach is to use the range of motion they have available that's pain-free. So in other words, if I have a patient that they can move their arm this high and be okay, but they go a little further and that hurts, then we're going to work through the pain-free range of motion. We're going to try to get that back, and then we're going to go beyond that a little bit at a time. Now, I will be honest, when most people come in with shoulder pain, we do need to get it stretching because we do need to get the arm moving a little bit, except in the case, which I forgot to mention, an instability problem. So I mentioned earlier on that the shoulder is an unstable joint held together by ligaments and tendons and all kinds of other wonderful stuff. But the shoulder joint is unstable, and some people are just hypermobile. They have a lot of mobility everywhere they go. It just moves all over the place. Sometimes they'll hear popping, sometimes they'll hear clicking, and that is really just the fact that the joint is kind of flopping around in there because it's not holding nice and firm and stable as the movements occur with the shoulder joint. So in those cases, some people will have pain, some people will be more prone to subluxations or dislocations at the shoulder joint as a result, and they're just more prone to injury because things are moving around, pushing in. So the bone could be pushing through into the tendon and pushing it through further than it needs to, or into the ligament, and that can cause pain and irritation because you're overstretching those structures. So in those cases, what we look to do is really hone in on trying to gain stability. So their range of motion may not be a problem at all, it's probably too much, so we need to hone that in. But generally, most people that come in, we're trying to get range of motion back. So I'm not a fan of a no pain, no gain when it comes to the shoulder. We try to work within a tolerable level and just use a progression of exercise across there. So we usually start pretty simple. We do what's called isometrics, where we just move the arm in different directions, resisting yourself in every direction the arm can go, and try to get some muscle activity. Helps decrease inflammation, and also is a way to work the muscles without having to lift and move the arm, because that's where the pain comes in. We don't really understand how heavy gravity is on us. So if I move my arm up here, gravity is pushing directly down on me, so my muscle has to be strong enough between the weight of my arm and gravity to at least overcome that. Now when you throw a weight in your hand, that just makes it even harder. So if I already have a sore arm that hurts to do this, again, why would I grab a 2 or 3 pound weight to exercise it to do that? It's just going to cause more irritation. So that's my approach to it. So as we progress through, and every person's completely different in how we approach it, I am a very much an individualized person, so every person that comes in, I treat them and look at them individually based on what their needs are. Even if it's the same issue I've seen 5 times that week, same exact injury, same exact problems, we still approach it a little bit differently based on each person's needs. So therefore, the exercise routine would follow along with that. So if I have someone who's elderly, who's trying to reach in their cabinets, put their dishes away, that might be an exercise we actually work on, is trying to get the arm moving in this direction and then slowly add some weight in. In general, we're trying to get the arm to move as much as it can in every single direction so that they have full mobility and full function. So as we progress along, we'll also use sometimes ultrasound, sometimes e-stim, we use some ice, we use some heat, different modalities to try to help. I work a lot on what we call, I mentioned this before, scapulohumeral rhythm. It's a really fancy word that means that your scapula, your shoulder blade, is moving along with your upper arm in harmony. And they're supposed to. And that's the way it was created. So if they're not moving together, you're getting pinching, you're getting some kind of abnormal forces on those shoulder joints and an alignment issue as a result. So that can cause more irritation. So I do focus a lot on that. We try to focus together and helping the patients understand how their body is moving and have better body awareness. Say that 5 times fast. So that they can have their shoulder moving in the directions it needs to move and not cause the same irritation. Because a lot of times our body's issues are really alignment or malalignment or just things moving at the wrong time is really what comes down to, because they're pinching if they're not moving the right way, if the muscles are not activating the right time. There's so many factors into that, but that's generally what's happening. So as the shoulder begins to hurt, that's what's happening. We're trying to recorrect some of those muscle imbalances and correct some of the muscle weaknesses, fatigues, and general re-education of the muscles really is what we're trying to do to get that back. So those are some of the treatments we would do. I do a lot of weight bearing stuff because, again, I like to put weight through the shoulder joint, again, in certain situations, not if it's severely arthritic and it's going to hurt to do that. But again, your body weight can act as a really good resistance force for the shoulder. So if I take a 5 pound weight and put it on my arm, yes, it's going to work my arm. But if I put my body weight down on my arm and I can use those muscles that are going to kick in automatically, now my shoulder doesn't have to move through a painful motion. It may be less painful if I have body weight on it to get those muscles kicking in. So a variety of different exercises we do. Some of the other options I'll throw out there again, depending on the severity of the injury. Some unfortunately do require surgery. So if there's a severe rotator cuff tear, usually what happens in those cases, I've had patients that have had zero pain, I don't know how, but they have no motion or strength. But it doesn't hurt them, so they live with it. Most others are going to have a lot of pain when they have a severe tear, which only surgery is going to really repair that. So once they repair that, then they're dealing with the rehab post-surgically and trying to get everything back that they lost before. Then there are other situations are people who just need a little bit of pain management. So a lot of patients will use a cortisone injection into the joint by an orthopedist which can help alleviate some of the pain and inflammation, and therefore we can try to just use therapy to get them back on track as long as it's successful. Some people live off of cortisone injections, unfortunately, just as a band-aid to keep avoiding a surgical intervention. But everybody has their own thoughts on that individually, so they have to do what's best for them. But I will tell you that as a physical therapist, I do know that we can help patients with shoulder problems from various different shoulder issues that they deal with, and we get them back on track. So if you are having any shoulder problems, these are some of the reasons why you might be having some pain, as we described. You're probably noticing some of the symptoms as well that we described, with loss of motion, loss of function, decreased strength, and pain. And the ways that you can help get that better is definitely seeing a physical therapist. So I would like to just say, if you have any shoulder issues, give us a call. We'll help you out. If not, call anybody who's local to you and they'll help you out as well. So physical therapy is a great answer for shoulder problems, and most people are definitely very successful when they go through the rehab of a shoulder issue. So hope you have a great day. Take care.